So the treatment of MS from the standpoint of a nurse is different from that of a physician just because of where we come from philosophically in our training. So we're treating the whole patient. We're also concerned about the person's family and their support system, and really developing or even creating the root of a good relationship for a practice. So for the nurse, the neurologist, the physical therapist, and that person and their family. Nurses are often the front line of MS care, and that they are the first to receive the phone call, and they're the one to deliver the message, the one to teach a person about side effects of a medication, and certainly while a physician may be the one to help the patient make the decision about what drug to take or what's going to happen next, the nurse is the one that kind of gets the fallout or is writing the letters. Now, I will say that in multiple sclerosis care, our healthcare team is so collaborative that the lines kind of blur. You know, sometimes I joke and I say that the physicians that are really intimately involved in treating MS are pretty nursey. You know, they have a lot of nursing characteristics because this disease state requires it. But we encourage persons living with MS to find a neurologist who has an MS certified nurse that works for that neurologist. And if they don't, we encourage them to make sure they're comfortable with their care and potentially just seek one out in the community to go listen to talks and get education. I think it changes the dynamic of the practice for the person living with MS because they actually might come in for a nurse visit just for education, or just to sit down and do a medication review or something like that. So in my practice, I work with predominantly with one physician to take care of people with MS, and like I said, I'm a nurse practitioner, so I'm diagnosing and treating and prescribing. My role is a little bit different. However, I also have to be the clinic nurse, so the one that takes the phone calls, the one that does the education. But I really think it's an indispensable part of MS care because we end up doing a lot more. In an ideal world, every MS clinic would have a specially trained neurologist, a nurse practitioner or a PA, an MS nurse, a social worker, a mental health provider. And that's just impossible. It's too expensive, and so we end up filling a lot of shoes. So an MS certified nurse is someone who has experience in MS care, so you have to have a certain number of hours prior to certification, and you actually take a certification test, and every 5 years you have to be recertified, and that recertification can come from taking the test again or proving that you have had a certain number of clinical hours in patient care, plus continuing education. And that can be in the form of attending conferences like the consortium or other meetings. We do a lot of regional continuing ed with IOMSN, or through putting on presentations, mentoring other nurses. The International Organization of MS Nurses actually keeps a list of all of our members and then all of our MS certified nurses. So if someone is looking for one, they just need to contact us to find out where one is. I don't think there's a state left where we don't have an MS certified nurse. Yeah. I think so. I think in chronic medical conditions, lifelong medical conditions like multiple sclerosis, nurses are playing a bigger role. But if you look in the body of medical literature, nursing literature, nurses play a really big role in diabetes. They play a really big role in asthma, Parkinson's disease. I think neurological diseases in general are a good space for nurses because there's so much patient education that needs to occur, not just with the patient, but also with their family.